For the first 40 years of the health service, doctors were very autonomous clinicians. They weren't really managed in any sense that people would recognise that word. We had administrators, not managers, and they were there to make sure doctors had the resources to do their clinical work. And doctors primarily were involved in doing clinical work rather than taking on management or leadership roles. That began to change in the 1980s when Sir Roy Griffiths produced his report on the management of the NHS. Two things followed. First of all, administrators overnight became managers, and hospitals appointed chief executives to provide the leadership that was thought to be necessary at that time. But also, Roy Griffiths said the time had come for doctors to play a much bigger part in the management of services and the management of budgets, especially in hospitals. And that was the beginnings of what we would now call the clinical directorate system within the NHS, with a number of senior doctors taking on leadership roles for different services and different specialty areas, or indeed what today I guess we might call service lines. And that dates from the mid-1980s onwards. What happened, of course, as a consequence was there was built into that some degree of tension. Hopefully creative tension, but not always so, between medical leaders in their clinical director roles and general managers, chief executives responsible for the overall leadership of their organisations. And very often that did lead to creative dialogue and discussion about how to improve quality and services within budgets. But sometimes, perhaps understandably so, it led to a degree of disaffection, especially on the part of frontline doctors who were not involved in leadership roles. And that was the beginning almost of a separation within the medical profession itself between doctors who became medical leaders and doctors who primarily continued with their clinical work and didn't feel as involved or engaged in the leadership of services and resources. There was a bifurcation within the medical profession. A small number, a very small proportion of doctors welcomed the opportunity to play a bigger part in the leadership of services, and they took on these new roles as medical directors and clinical directors with a great deal of enthusiasm, even if initially they had very little training and support to do so. But the great bulk of doctors continued to focus on their clinical work, their teaching and their research, and they found themselves under much more challenge than ever before. And that really is what led to the tension and the conflict, to some extent the disaffection, you might say, of a growing number of doctors that the way the health service was changing, in their view changing for the worse rather than for the better. There has been some movement. I don't want to give the impression that the health service today is fundamentally the same as it was 30 years ago. That would be wrong, because we have seen more doctors going into leadership roles, and we have seen some successful examples of NHS organisations that have embraced that with enthusiasm and have benefited around their performance and the improvements in patient care that have resulted. But the sad fact is, in my view, those organisations are still in a relatively small minority. I think we know as much as we need to know. I think we have a pretty good diagnosis of why we are where we are at this point in the evolution of the NHS. We're also in a fortunate position of having some very good role models, some fantastic examples of some NHS leaders and organisations that have got it. And the performance of their organisations demonstrates why this is really important. So for me, it's much more, why are we not acting on what we know, rather than why do we need more research to help us understand how we got into this position in the first place?